Good evening, good people. I'm Kiplyn Primus, host of The Local Take on Jazz 91.9 WCLK. And tonight we've joined forces with AARP Georgia to present this town hall on COVID-19. We also want to thank MedCura Health Centers and CAU TV. And we'll start with greetings from WCLK's Wendy Williams and AARP Georgia's Deborah Tyler Horton. Ladies?
Hello, I'm Wendy Williams, General Manager of Jazz 91.9 WCLK. Jazz 91.9 is proud to partner with AARP Georgia to present the Local Take Town Hall about the COVID-19 health pandemic that disrupted all of our lives 1 year ago. Since then, WCLK has made it our mission to stay on top of the latest pandemic crisis news and deliver information on community resources, as well as share new developments that address individual and family concerns. The Jazz 91.9 WCLK Local Take COVID-19 Town Hall will bring together expert health professionals, physicians, community leaders, and medical scientists to talk through the importance of COVID-19 testing and screening and lay out the particulars about the COVID-19 vaccination, dealing with senior isolation, mental health, and surviving this new COVID-19 economy. It is our hope that the information shared during this town hall will be both insightful and helpful. And now a word from tonight's sponsor, AARP Georgia.
Thank you, Wendy. Good evening. I'm Deborah Tyler Horton, the State Director for AARP Georgia. It is my pleasure to welcome you to this COVID-19 Town Hall. Our goal is to educate and inform you about choices you have for taking the vaccine and learn how to reclaim a bit of financial certainty. AARP has several resources available that might help you along this journey. 2020 and the pandemic were a double whammy, yet it seems like there might be some light at the end of the tunnel. We know this road has been overwhelming for many of you, and we understand the uncertainty you might feel. Our hope is that the next hour with our panelists will help you navigate your next steps as we look forward to a brighter future. A special thank you to WCLK for coordinating this town hall. We appreciate your attendance and look forward to staying connected. For other AARP events, please go to www.aarp.org/GA. Thank you. Take care and stay safe.
Right now, AARP's work is more important than ever. We hear older Americans loud and clear, and that's why we fight for what they and their families need. Access to health care, affordable prescription drugs, opportunities to save for the future, ending age discrimination, a healthy, financially secure, fulfilling life. That's what AARP fights for, because that's what everyone deserves. Join us in fighting for what's right.
Welcome back to our town hall on COVID-19. For our first segment, I'd like to introduce Dr. Teresa Jacobs from MedCura Health Centers and Dr. Elizabeth Ford from the DeKalb County Board of Health. Doctors, ladies, welcome to the town hall. Dr. Jacobs, can you share a little about yourself and why you chose to become a physician?
I'm a family medicine physician. I work at a community health center. One of the main reasons I decided to go into family medicine, to actually become a physician, some 30-some odd years ago, I was pregnant, and the healthcare treatment that I received was just horrible. The folks were not very nice. They didn't smile. They kind of grunted. And I didn't think human beings should be treated like that, regardless of their circumstances. So I made a decision at 35 years old to go back to med school. And I did, and I'm so glad I did. I now work play, and live in the same community where I treat my patients, trying to make a big difference or a better difference with our patients that we serve.
And Dr. Ford, can you tell us a little bit about your background and why you decided to focus on public health?
Sure. Thank you for having me first. So I'm a pediatrician by training. I did my residency in Children's in LA, but I trained at Howard University Hospital. And so I was offered the opportunity to come back and practice at Howard. And I saw a lot of disparities, a lot of inequities in terms of healthcare delivery in DC. And so while I was at Howard, I got an MBA and wanted to run the hospital, but other opportunities presented themselves in public health. And I got a job, a very high level job for a pediatrician in the Florida Department of Public Health, and just fell in love with it and realized the span of influence, that public health has. Public health is everything. Restaurants, travel, all kinds of chronic diseases. And so I've just never regretted sticking with it all these years. It's been 16 years since I've been in DeKalb now.
And we are glad to have you. So our first segment is about back to basics. And for both of you ladies, as vaccinations have increased, have the basics changed?
Oh, absolutely not. Even though folks are getting vaccinated, you still need to wear your mask. You still need to social distance. You still need to wash your hands. You still need to do all of the things that the CDC guidelines are advising us to do. So we still need to practice the basics, especially when you're out and about, grocery stores, the malls. You still should continue those basics.
And Dr. Ford?
I'm going to kind of answer that from a different approach. Back to the basics. So what we saw when COVID first hit was this inequity in who got sick and who died and who was hospitalized. And part of that had to do from the very, very basic level of access to testing, because remember, everyone couldn't even get a test, particularly if you didn't have a physician attached to you. So what we're seeing now, even with vaccine, we're still seeing an inequity. The people who need the vaccine the most are not necessarily the people who are accessing it. And so, we're still back to where we were. It's just on a different level. We're still not hitting who needs to be hit the most.
Dr. Ford, that leads me into another question. They always say take advantage of a catastrophe. Is this a catastrophe where we will finally address health equity? And if we've brought it to the forefront. Everyone is aware now that it exists. How can we use this time, this catastrophe, to make some real change?
That's a great question. It's a really frustrating question because, people act as if COVID brought about health inequities. And those of us in the healthcare profession understand that health equities have been around for generations. So what I am happy about is that they're at least being highlighted at a national level, and people are really talking about it. And so I hope with conversation comes change. And so what we need to do is take advantage of this catastrophe and make some real changes in how healthcare is distributed and delivered in our community, so that the next time we have this, and we will, that we don't see these imbalances in who gets to live and who doesn't.
And we're talking about the COVID pandemic, but hypertension is at epidemic levels in our community. Diabetes is at epidemic levels in our community. Dr. Jacobs, what can we do to help increase the trust between our community and those in the healthcare community?
I think that we have to have more town hall meetings like this. I think that they need to see more people that look like them in medicine and public health and on the front lines. They need to see more of us. And then we need to handle misinformation with the truth. Make sure that we're explaining to the patient, explaining to them right where they are, because a lot of folks have a lot of mistrust when it comes to medicine, when it comes to the vaccines. So we have to handle it, meet them where they are, but make sure that you give them the truth, that you talk about the science, the evidence that's out there. Many of us have gotten the vaccine, so we can show, look, I got the vaccine and I'm fine. I got both dosages and I'm doing well. So the more information that we get out there to the community, I think the better off they will be.
And Dr. Ford, does public health have a relationship to increase that trust with the community so that when the misinformation comes, they have a resource to go to, or they know that they can call the Board of Health and get the right information?
Absolutely. And, the medical community and the public health community has taken a big hit in its response to COVID as it relates to trust. And so the two things that need to happen is transparency.
Yeah.
This is what I know today, because the guidance over how we are managing COVID, if you look at March of last year and it's like night and day. And so it doesn't mean that we were wrong. It means that's what we knew then. And so that takes humility to say, well, I don't know that right now. I'm operating on the information I currently have. And so I think that there's this little bit of arrogance in the medical community, like I have the answers, I know, and we don't. We learn something new about this virus literally every single day. And that's what the public needs to understand is we're figuring it out just like they are.
So with this being a novel, as they say, virus, of course the information has changed, but what is our job? The media, the public health professionals, the leadership, what is our job to try to combat that misinformation?
I think that the job of media is to not take the fire part. I think people love scandal and sensationalism, and just like we're hearing now with the vaccine. Oh, somebody got the vaccine and got super sick. These types of things. I think that the media would be really helpful in presenting even sharing of information, so that we don't always go to what's the most salacious and scandalous, and just to really allow public health experts and clinicians to say, hey, this is what we know today. No, that's not true. This is what's happening. We could be really strong partners. I have had great partnerships with the media in trying to get messaging out, and I really appreciate those platforms.
And for both of you ladies, this pandemic has created a whole industry around telehealth, telemedicine, people popping up. There were buses going around to different neighborhoods giving vaccines and doing testing, the mass vaccination. So the way that healthcare has been delivered has greatly changed due to the pandemic. What does the future of our healthcare look like from public health to community health? Dr. Jacobs, would you like to go first?
Yeah, I think it's going to be a hybrid of what you see right now. So there's still going to be in-person visits, folks coming in for their physicals and what have you. But telehealth is here to stay. So if you don't know that, it is now here to stay. We're able to do a whole lot, even through telehealth with med refills. We've been able to reach a huge number of patients that had difficulties coming into the office when the offices were shut down. We were able to reach a lot of our patients. Now, we still have some work to do because there are areas where broadband is still an issue. So telehealth is not really up and going well. And so not all of those patients are actually still coming into the office. But now there's social distancing, even in the office, folks wearing masks to make patients feel more comfortable and safe, even coming into the office. But there's going to be a hybrid of both of them going forward because telehealth is here to stay.
And Dr. Ford, how does that impact public health? Does that mean you all can reach more people? Or does the lack of broadband and the digital divide still impact with public health?
Sure. So catastrophe brings about change. And, we had two things going on. We've got a global pandemic, but that pandemic also impacted my staff. So I have staff that are medically fragile and couldn't come to work, or I have staff that have childcare issues because now the schools are closed. And so now I have to figure out how to deliver our usual level of services with a third of the staff and do COVID testing and do COVID vaccine. And so what it did was it pushed us because then we had to figure it out. And so we've been talking about telehealth for years, and we need to get on the board, and yeah, we'll get to it, and now we had no choice. And so everything has been ramped up, pushing us into that realm because it had to happen. And what we have learned is there's so much that we can do that does not require face-to-face interaction. I'm still old school fan of, putting your hands on folks, but we can still get a lot accomplished without actually having to be in the same space. And the technology now with telehealth is extraordinary. And so we really do have a whole nother realm of healthcare delivery. But yes, to the other point, it's still, again, here we go with the disparities, because if you don't live in the area where you've got the great bandwidth, you don't get the access to that.
Mm-hmm.
Well, ladies, I want to thank you so much. We're going to move to our second segment now. Dr. Jacobs, we're going to keep you here. Dr. Ford, we want you on standby. And we're going to have Dr. Jeffrey Hines join us. And our second segment is about the vaccination. We're going to talk about the good, the bad, and the ugly. And I will let everyone know I am fully vaccinated. I got 2 doses of the Pfizer vaccine, and I feel good. I mean, there's a little stress relief knowing, that someone sneezes on me, I won't die. So I'm glad to introduce you all to Dr. Hines and Dr. Jeffrey Hines. If you could tell us a little bit about yourself and why you became a person with a medical career. Dr. Hines?
Hello.
Yes, I can hear you now.
Hi. Thank you, Kiplyn, and thank you for this opportunity to participate in this important town hall. I will start out also by saying that I am fully vaccinated. I was one of the early ones. I got the Pfizer vaccine in late December and early January. I'm right-handed, so I got it in my left arm, and my arm is still there. It's important for people to know that, because there's a variety of myths that are out there. I'm a gynecologic oncologist. I take care of women with GYN malignancies. I do their surgery and their chemotherapy. But importantly, a new position that I've taken on with Wellstar Health System is I'm their medical director of diversity, inclusion, and health equity. Throughout my career in GYN oncology, we have looked at disparities, and particularly in women of color who don't do as well with certain malignancies. And so for me, when Wellstar asked if I would serve in this role, it was kind of a natural. Why did I become a physician? Very similar to what my colleague panelist says here. When I grew up, there was no one that looked like me who was a physician. So that was truly one of my driving forces. I wanted people who look like me to take care of me, and in the future for me to take care of people who look like me. So that was my impetus to become a physician.
I love it. I think these are wonderful stories that you guys are sharing. But Dr. Hines, I'll stay with you. How do we approach vaccine hesitancy? Because I was hesitant to tell people I had been vaccinated because it seems like it's controversial. Although it really shouldn't be. You get your flu shot, I got the shingles vaccine. Vaccines are good for you. So what can we do to move people beyond that hesitancy that exists in our community?
That's a very loaded question, because hesitancy isn't just skepticism. I'm going to go back to one of the panelists last time. Hesitancy also is access as well too. So I'm going to answer the question in the following way. There are people who are hesitant, and we have to first acknowledge why they are hesitant. And there are historical reasons why people of color, and particularly Black people, may be very hesitant of science. I mean, we have J. Marion Sims, who experimented and operated on, enslaved Black women without anesthesia. We all are aware of the Tuskegee, or many of us are aware. There's probably a generation of people that are not aware of Tuskegee, but the end of Tuskegee was in the early 1970s, not too long ago. People are aware of things like Henrietta Lacks, and many imprisoned women who undergo forced sterilization. So there's a lot of reasons why communities are hesitant about medical science and science. So I think the first thing you have to do is you have to acknowledge that.
Mhm.
The next thing you have to do is you have to listen to people. And then the third thing that you need to do is you need to educate people. We need to educate people about the science behind the vaccine and how it wasn't rushed. Anytime I get a chance to talk to people, I try to bust one or two myths. There are no microchips in this vaccine. And we've all heard that.
Yes.
Yeah.
There is no live virus in this vaccine. It cannot make men and women sterile. You cannot pass it on to your next generation of children. So the importance of busting myths and alleviating and busting misconceptions is important. But the other thing we have to realize is that I'm a big data person. I always say, in God we trust, everyone else must bring data. There are published reports that are coming out that much hesitancy in the Black community is due to the fact that many Black folk think that you have to pay for the vaccine and they can't afford it. So there's some messaging that we have to do that really goes into hesitancy. And the whole idea is to bring the trusted messenger to people with the trusted message. And there's going to be a variety of people that are going to fit that bill. I am hopeful tonight that many of us are going to be that trusted individual, but there are people that are not on this call tonight that can be those trusted individuals. Your faith leaders, community leaders, activists, entertainers, sports figures. So we need to get a whole bunch of people together to provide that trusted message to a particular audience. It needs to be culturally competent, and it needs to be language proficient as well, too.
And Dr. Jacobs, we are getting questions on our YouTube stream, and this is one of the questions that comes up that I don't understand. Which vaccine should you get?
Well, that's easy for me because I'm going to tell you the recommendation is whichever vaccine is available, because they all protect you from severe COVID disease, from hospitalization, and from death. So whichever vaccine is available to you, that's the one that you should take because it's going to be great coverage. There are very little side effects from all of them. They're all similar in nature as to what they do. They help your body build up an immune response to antibodies to protect you from getting severe COVID disease, hospitalization, and death. So that's the biggest that is the biggest thing I want folks to know.
So it doesn't matter. Whichever vaccine is offered, that's the one you should take. Dr. Jacobs, you and Dr. Ford in the last segment talked about this being a novel virus and things changing. You all are learning as we are learning. And one of the things that has come out is that if you are fully vaccinated, you can gather in small groups with other fully vaccinated people. And a lot of people took this as permission to gather with their grandchildren, but children can't be vaccinated. So how do we interpret that rule? What does that rule mean? Can you gather with other fully vaccinated people?
Absolutely. So the CDC guidelines are if you're vaccinated, you've got some grandkids that are low risk, and their household is okay for them to come visit you and you can see them without your mask. Now, the caveat to this is if you've got several children that have grandkids, they don't want you to have all of the households at your house at the same time. So what you can share or visit with one family, one of your kids and their kids, but not to have the big gatherings where you have 20, 30 folks all together like we used to. So we're not quite there yet, but you can certainly have a small gathering with yourself and one daughter and son-in-law with their children. So one family.
One family. So do it in little portions. Take it a little bit at a time.
Absolutely. As long as they're low risk. That's the key, that the children are at low risk.
And Dr. Hines, we are trying to get as many people vaccinated as fast as possible to reach what is known as herd immunity. What happens if we don't get there? If we don't get enough people vaccinated, what happens?
That's an important question. And as Dr. Ford and Dr. Jacobs said in the previous session, we are still learning about this disease. But most of the experts would say that somewhere between 70 and 80% of adults, because again, right now, the vaccines are only available to 16 and above for Pfizer, 18 above for Moderna and the J&J product. If enough people don't get vaccinated, then what's going to happen is the virus is going to continue to circulate. It's going to continue to infect people. And what, this virus is not going to go away. Just like other viruses like, measles and mumps, they don't go away, but enough people are vaccinated. So there's not really a host for them to go to. But the problem is, and we're seeing this in certain countries, like in Brazil right now, because the people were still transmitting this virus, more and more of those variants and strains are going to come up, and it's going to make it harder to get the disease under control. So it's going to be real important that we get enough people vaccinated and people to continue to wear their masks, watch their distance and time, and wash their hands.
And Dr. Jacobs, we've talked about access. And even when I got my vaccination at Mercedes-Benz, the majority of the people there were not African American. Mm-hmm. How do we, and I would have thought Mercedes-Benz is on the MARTA line, it's an easy place to get to. I thought that was the place for us. And clearly, it was not. How do we get past that access challenge? And when do you think there will be enough vaccines in the community so that you're not having that appointment challenge?
Yeah, I think that we're going to get there soon, because with this current administration, they're actually ordering enough vaccines for all of us to have. And I think our president even said by the end of April, there should be enough vaccines for every adult that need it and want the vaccine. So soon and very soon, that's not going to be a problem. We're going to have more vaccine than probably people that want to get vaccinated. But little by little, it's being rolled out. And you see there are different offices now. There are mobile units that are going out to specific communities. There are folks even setting up vaccine sites at local churches. And there are churches where there are people of color, Black and brown people are attend there. And so we've got pastors that are encouraging their congregants to get these vaccines. And so they're bringing it to the community, not just to Mercedes-Benz, to the stadium there, but they're bringing it out to primary care offices, to local pharmacies now. And so they're going to make access fairly easy, but it's rolling out. So just give it time. And I'm told by the end of April or so, we should have enough vaccines for everyone 18 and above that desire a vaccine.
And Dr. Hines, I'm going to give this question to you, but this has come through our chat. People talking about their fathers, their significant others, the men in their lives who are not interested, who think, I'm all right. I'll keep wearing my mask. I'm good. I don't need a vaccine. What do you say to men, and I'm sure there's some women too, but this is sometimes uniquely a man thing, to think, I don't need help, I'll be good, I'm not getting a shot.
And that's a challenge. It's interesting because in many organizations, and much of the data actually says it's the opposite. It's women who perhaps are more hesitant or skeptical, especially childbearing women. And we can talk about that another time. But I think it's that same thing in general with men. And again, there's data to support this. Is who drives healthcare in a family is usually the woman. So I think, again, getting the trusted message, and I think doing focus groups, talking to men. Who do you trust? Who do you listen to? Are you going to listen to, a sports figure? Are you going to listen to your faith-based leader? And I think that's the person that we need to tap to do that very important messaging to men so that they make sure that they get themselves vaccinated. And then they model that behavior to other people, to other men, other people in the community, other people in the household. I just want to make one other comment about that equity piece, because I think one of the issues that we have done nationally is you don't necessarily do work in equity with speed. You get equality sometimes with speed, but you get equity with intentionality. And I think we nationally didn't lead with equity. We were all judged by how many shots can you get in the arm. But now it's becoming more apparent that we need to lead with equity. If you look back a year ago, how long did it take organizations to start to report hospitalizations and deaths by race and ethnicity? We're seeing the same thing now. How long is it taking them to report vaccinations? And we're all seeing nationally and in our own city that Mercedes-Benz is mostly people who are not of color, because lots of people have multiple kids in their family that can get on these type of devices, 3 and 4 devices at a time, and make appointments. And you see people who normally go to parts of the city that they would never go to get a vaccine. So Dr. Jacobs is right. We need to figure out, and we know the ways to do that now. How do you get shots in the arm of people where they are? You also have to take into account, not everyone can take time off from work to stand in a 4-hour line or whatever to get a vaccination. So, you need to have timing and times and hours set up so that people in certain communities can get their vaccinations.
And Dr. Jacobs, can you share how MedCura is working with access? Because you all are in neighborhoods that, people don't have to even take the bus. They can walk out of their apartment, down the sidewalk, and there's a MedCura clinic. Can you speak to how your clinic, the MedCura Health Centers, are working to increase at least access, if not equity?
Oh, absolutely. So one of the big things that we've been doing is on the phone, making phone calls, calling all of our patients. Before we even got the vaccines, we were making a list. Would you like the vaccine? Educate them. This is like my 5th talk for the community this week. So I'm doing community talks. I even with the AKAs, with specific churches, fighting or giving the truth instead of misinformation. And so we are taking names, writing them down. 5 days a week, we're giving those vaccines. On Monday, we're going to actually open up a drive-through right there at South DeKalb Mall. So we're not only doing testing there, but we're also we'll be giving the vaccines out as well through the drive-through right here at South DeKalb Mall. So all someone would have to do is call MedCura Health, our phone number, and they would be able to get an appointment. You'll be placed on the list. They'll call you back to give you a date and time when to come. But there'll be a couple of different sites you'll be able to get that vaccine. So but these are patients that I know we love. We see them on a regular basis. So we know their moms, we know their dads, we know their children, we've been to their graduations because we're a community. So when somebody in their community, their physicians, their OBGYNs, their pediatricians, and we're telling them we've gotten the vaccine, so it's safe for you to get it too. It makes a huge difference when they know that we've gotten it. There's no arms growing out of our necks or anything like that. We're still alive. We're still talking and joking with them. And believe it or not, I can see the tide turning. You could see, when we talk to these community groups now, folks are going, oh, well, she got it. She's doing well. Her brother got the shot. The CEO of the company got the shot, got the vaccine. The medical director got the vaccine. They're all doing well. And so I can see in the community, it's turning slowly, but the more we get out into the community, let folks know that these vaccines are safe, and we make it accessible for them. Like the doc was saying that folks folks can't take off from work, so we're trying to make it available at different places, different sites, allowing the bosses to let these folks get off from work. We do small groups of employees from a specific company so that they can get their vaccine and then go back to work. So you have to work with them wherever they are in an effort to get these vaccines out.
Now, you all have both mentioned that part of the reason you became physicians was that there weren't many people who looked like you, or you had experienced, shabby treatment in the traditional healthcare system. How can we start a school to medical school pipeline for young people in our community so that we do get some cultural competency, so that we do go to doctors who look like us? And, we can talk about, mama told me if I put the onion in my mouth, I wouldn't have to worry about the tooth. And you know exactly what that means. Or I had my ginger ale and soda cracker and I'm still feeling bad. How can we get more young people to know that this is accessible? Or even, Dr. Jacobs, you said 35. I can't imagine that. But how can we get more of us in this healthcare community?
It's going to take more of us that are in the community already to go out and talk to them. There are programs through the American Academy of Family Physicians. They start talking to kids in 4th grade, believe it or not. So we start talking about medicine. We start talking about other health topics, tobacco, because usually around 9 or 10, that's when they're curious. They're starting to smoke. So there's a program that we throughout the nation where in 4th grade. And so I volunteer. There are other folks, Black and brown folks, that volunteer to go out to these schools before the pandemic to talk to these kids starting in the 4th grade. There are other programs for middle schoolers as well as for high school students. We've also had out at Morehouse, invited high school students over there. Oh, yeah. I've been one of those docs to sit up there and talk to them about med school and the different things that you can do as a physician. And so it takes more of us that are already in the community to reach back and let's talk to these young folks so we can let them know if I did it at 35, you can do it at 19, 20, 21 years of age.
And Dr. Hines?
Sure, I agree 100%. I think you have to start early. Yeah. You've got to be intentional, and you've got to have good mentors throughout young people's careers. And you got to provide guardrails for them. And those guardrails include not only mentoring, but opportunities to work and shadow physicians that look like them, to come into the OR with me if you want to and work on the robot. But also there needs to be intentionality around the finances around a medical education as well too. So it's going to take not only the mentoring and the financing, the mentoring and the sponsorship, but what are the enrichment programs? What are the pipeline programs that we can get our students in? And what's the financial plan for them to finance a medical education?
Yeah.
Well, I want to thank you guys so much for making this second segment so very compelling and so very interesting. And, hopefully we can increase access. I'm fully vaccinated. Dr. Jacobs is fully vaccinated. Dr. Hines is fully vaccinated. And we are not having challenges. In fact, it really does feel good. We are about to go over and hear from one of our sponsors. WCLK will be having their spring pledge drive before the end of this month. And MedCura Health Centers is our nonprofit partner. So when you make a pledge to WCLK, you can also make part of a donation to our nonprofit partner, which is MedCura Health Centers. And we've just been talking to Dr. Jacobs about MedCura being the community neighborhood health center where your doctor actually goes to your graduation and knows your mom and dad and all of those good things. So here's a message from WCLK about their upcoming spring pledge drive.
Jazz 91.9 WCLK, Atlanta's jazz station. Classic, cool, contemporary. This is Jazz 91.9, my favorite station. Listen at home, work, on your computer, in your car. Member supported, national public radio affiliate. Jazz 91.9 WCLK, Atlanta's Jazz Station. Listen up.
Yay, we want to thank you all for joining us. And we also want to thank AARP Georgia for sponsoring our town hall. We want to thank to everyone who is tuning in and to our presenters, CAU TV and MedCure Health Centers. And we're going to turn our focus now to mental health. And we're bringing back Dr. Elizabeth Ford from the DeKalb Board of Health and Dr. John Wilson, a psychologist from Completely Psyched. So, Dr. Wilson, welcome to the town hall. Can you please tell us a little bit about your background and why you decided to become a psychologist?
Two-time graduate of Howard University, doctor from the University of Miami. While at Howard, I was undeclared, didn't know what I was going to major in, took an introduction to psychology class, which caught my interest immediately. And that led me on the path of staying in psychology until I got my doctorate. Worked previously as faculty at Georgia State, moved here from the University of Texas where I was working as a staff psychologist. And for the past 8 years, been in private practice near the downtown Decatur. And so my practice comprises of working with individuals from teenage years up into seniors. And I also work with couples. But really, psychology has been the only thing that has been of interest to me, and it's like a natural thing. People have always felt comfortable talking to me, sharing things with me, even before I knew why they were doing it when I was young. And so it was just a natural kind of organic thing. And fortunately, I ended up taking a class simply because my roommate was taking the class, and it was the thing that got me hooked into psychology. And so here I am today, some 30, I don't know how long, 30, 35 years later, I'm still doing this kind of work.
Well, we want to thank you so much for joining our town hall. And, we've all experienced trauma in the last year. I don't think anyone was prepared for the pandemic to last this long. Dr. Wilson, what can you tell us about how trauma, anxiety or depression might present itself? And sometimes they're in ways that we don't recognize. We know something is wrong, but we can't figure it out.
Well, one of the abilities we have as humans is we have the ability to adapt under extreme circumstances. And sometimes we are not aware of how much adaptation is going on and how much stress we're under. And so when COVID hit last year, I think initially, at least with my clients, they weren't particularly stressed because of all the words coming out of the administration of Donald Trump. And also locally, it was presented as this is going to be like a couple of months. And then I think people are somewhat excited about not having to go to work and work from home. But I'm going to say like in June and July, I noticed a turn. I think people started realizing we're not in control of this virus, and our lives were being impacted in ways that we didn't anticipate, and we did not have the ability to turn it back. And so with that, now granted, when COVID hit, people are living their lives and they're already dealing with whatever relationship issues they're having to deal with, if they're already depressed or anxious, or they're dealing with some type of life transition. And then you on top of it, you throw in having to deal with a virus that no one really had information about. We're learning every day. And back then we really didn't know. There was no vaccine on the coming forward at that time. And so there was a lot of just kind of exaggeration of depressed mood, anxiety reactions. I think relationships were hit hard. And so it was a tough time. And a lot of it has to do with not having control. And we do, as humans, we like to feel like we have some control, even if we make up stuff to make it feel like we're in control. So I call that the illusion of control. And so I think that escalated. And I did notice a difference with clients I had been working with from the beginning of the year throughout the year. They tended to manage much better. They didn't have the symptoms weren't exaggerated. And in fact, many of my clients actually thrived last year. They were able to do many things they had not been able to do for many years because of either procrastination or didn't have the time or the wherewithal to do it. Promotions, children, having babies. buying homes. Now, the people that maybe joined my practice into the year, they had a much rougher time in dealing with this kind of control um, inability due to the virus, and not knowing when it's going to end. And in addition to all the stuff that was going on in terms of the political stuff last year, police brutality stuff last year, protesting last year, and so it was just compounded on individuals that made it real rough for some people. And so I reminded people, say, even if you don't feel stressed, I want you to assume that you're extremely stressed, and I need you to come up with additional creative ways to manage that. So you can't rely on what you've always done. So whatever you did in 2019, that's not going to be enough. So just assume that you need to do more. And so it required people to be a lot more creative. Some people were able to do that. Many of my clients were, but some weren't. And so the year was, the year was even more stressful and more challenging than they anticipated.
Well, I think it's funny that you said most people started feeling bad around June and July, because I was feeling good until Google announced, I think in mid-July 2020, that their employees wouldn't have to come back to work until July 2021.
Right.
That was when I nosedived. I really
Right.
did.
So like we started getting information from major corporations, the different sport leagues were shutting down. And so, I mean, you're getting messages from Governor Kemp and President Trump that were minimizing the reality of what we were dealing with. But I'm looking at certain businesses, and I'm like, they're shutting down up until either the end of the year, going into 2021.
2022, yeah.
Right. And so, and you're right, 2020. And so I'm like, no, this is more serious. And so, and then just watching how different professionals like Dr. Fauci, that's the dude I'm listening to, how he was being shut down and being attacked. And I think at some point it started hitting everybody, or many people, that this isn't going away. And then the numbers were also creeping up, and it wasn't 500,000 people dead as it is now over, but the numbers are going up. And I had to remind clients the significance of these numbers. Like these are a lot of people, and this is the official number. Now, my assumption is probably more, but the official number was high, and it was growing at a higher rate, and there was no second wave. And so, a lot of my work with some of my clients was kind of keeping them in a place of reality. Like you have to deal with what's in front of you, and not distort reality, and not kind of have this hope that things would somehow magically improve because some politician said it would, or some business person said it would. I encourage my clients to pay attention to the professionals, to the scientists and the medical professionals, because they're going to have the information that you need to kind of have a perspective that's going to get you through this.
And Dr. Ford, how did public health handle the mental health crisis that has been a part of this pandemic?
Sure. So it's a challenge for public health because the mental health component is not run by the health department. It's a separate agency, the Community Service Board. But we all know that mental issues manifest in physical signs. And so a lot of the headaches and stomach aches and all of those types of things, sometimes just loneliness. And they were having a lot of seniors, for example, that were isolated in their care centers, unable to see family members, die literally of loneliness. And so, we've seen the desperate need for human contact and what happens when you can't access it. And so it's tough because, people want to be around each other. Sure, there are populations of folks that just absolutely refuse to wear a mask and socially distance just because they feel like it's a violation of their civil liberties. But I think most of the time when people are gathering outside of what we are recommending, it's because they want to be around other people. And so we have to be mindful of that and thoughtful about it. I mean, we've seen how our children have struggled not having the access to their classmates in school. And so it's a real thing. And we have to make sure that parents have the tools to manage this, and that because this is unusual for all of us, and we're all dealing with it in different ways, even from the perspective of people being isolated and putting on a whole lot of weight, and what that does to your health. So it's a lot. It's a lot of higher rates of substance abuse we're seeing, certainly higher rates of domestic violence we've seen. So, I mean, and these are all public health issues, and we worry that we're not seeing the high rates of child abuse, but that's because the teachers aren't seeing these children to report.
So we're talking about, the fact that as a community, we've all been traumatized. The last 12 months, the pandemic, the racial unrest, the insurrection, it's been one hit after another. And introverts may be having, a better time than the rest of us. But even for some introverts, the isolation, becomes too much. I did a training a few months ago, and a lady who lives on her own, when the Zoom came up and she was on camera, she immediately said, "I'm sorry, this is overload. I gotta take the camera off." And she took a good 10 or 15 minutes before she could come back in and, be with everyone. So it's little things and it's big things, but how do we address this? And, Dr. Wilson, you're a psychologist, but we know even before the pandemic, folks with insurance sometimes couldn't find a mental health professional, within a 20, 30-mile radius, of their home. So how can we address this when some of us don't have access to a counselor? What do we do? Dr. Wilson?
Well, that's $1 million question. Wow. Well, I don't. That's a hard question to answer. But what I'll say is, one of the things I did know, I have noticed it is more difficult to find therapists now than people were able to find back in 2019. And this is coming from people, because I know my practice did not skip a beat when it went total telehealth back in April. And I've been full pretty much since then. And not even being able to get back with people who call me maybe a week, 2, even 3 weeks out. So people having to wait for me to return a phone call. The clients, at least my client base, they have been referred by either, my friends or by church members and things like that to seek out some type of assistance. And I've had clients refer their family members to me. And fortunately, they've been able to access. They had, they could pay out of pocket or they had decent insurance. Now, I am concerned, with individuals who don't have health insurance, because this can be a pretty costly endeavor. And then if you tie into what like what you're talking about the last segment in terms like gender stuff, and so men in general just find it really difficult to acknowledge that they need to talk to somebody. And so typically they're forced to do so by girlfriends, wives, or their job. And so that becomes a hindrance to people coming in. Now, I do think we were talking about, I do think the fact that I'm a male talking about the importance of self-care and it's okay to ask for assistance and it's okay to recognize that you're feeling overwhelmed with everything that you have to deal with has been beneficial. I've been pleased to come across a number of like teenage boys who have been, in some ways, more versed than some of the adults I work with, more understanding of the complexities that the virus brings, the importance of kind of taking care of yourself, the importance of encouraging the adults in their lives to get vaccinated, and speaking about it in a way that goes beyond their years. At least my experience of a 16-year-old, and so it's been an interesting journey, and I'm finding as the year went on, more people were more comfortable engaging in looking for therapists. And typically people don't think males are really doing that, but I've gotten more calls from men, particularly Black men.
Yay!
And Black men who aren't being threatened to seek out therapy. They're doing it on their own because they recognize that they're having some difficulties, or they want to relate and support their family members, even in the face of being criticized. Like I'm thinking about a client who was very protective of his girlfriend, who was very concerned about the virus. So he was making choices that benefited her mental health, but he's been somewhat, I won't say attacked, but he's been shamed around doing that. Like somehow he's not, like he's being controlled by his girlfriend, or he's being controlled by this irrational fear called coronavirus. And so I've been very pleased to kind of just notice this. I mean, I wasn't particularly expecting this particular change coming from many of the men I come across, because typically I have to kind of finagle and press and confront guys to go to make a doctor's appointment, get a physical, get your blood pressure checked. But I've noticed over this past year that has been happening much less, and so I feel positive about that.
And Dr. Ford, are you all finding that more people are actually reaching out and trying to engage with mental health practitioners?
Well, I think that because to the doctor's point, the challenges that Dr. Wilson mentioned about access, I think it's become more of just friends and neighbors and people just doing check-ins. Are you good? Are you okay? Because of the isolation, I know we have a lot of family Zoom calls. We have a lot of weekly check-ins just among my friends, because, everyone just wants to make sure everyone is okay. So it may not be a professional level, but just that emotional connection of, are you good?
Right.
And that is so important, to ask that question and wait, not, hey, you doing all right? Yeah, I'm doing good, and keep it moving. How do we get more of us to understand that sometimes we can be the saving grace for someone in our community if we can listen? Dr. Wilson?
Well, I encourage people, like you don't necessarily need a professional with a multitude of degrees to be helped. We all want to be heard. We all want support. We all miss being around the people that we care about. We miss the physical touch, the closeness, the conversations. And so I encourage people that, check in on people, but also, let people know you need them to check in on you. Because I do recognize that sometimes people aren't aware to ask for what they need with regards to this. And so, or they're in a habit of always being available for other people. And so, they get those needs met, but then they're not focusing on what they need in a particular moment, because they're taking care of other people, or they're focused on other people. But you also have to do self-care around this. And so we all want to be, we all want somebody to check on us, make sure we just basically okay. And you don't need a social worker, a psychologist, a physician to have to do that. You have the power as a human, as a son, a daughter, a husband, a wife, a sister, an auntie, a grandparent. You have the power to make your loved one feel like they're being thought of. You have the power to listen. We all want to be heard, no matter what we're saying, no matter how rational, irrational it is, or how crazy sounding it sounds, or how reasonable it sounds. We all want to be heard. And, in these times, it's easy to feel isolated, and to literally be isolated.
Mm-hmm.
And so, there's some people who never leave the house because they're ordering food through Instacart and DoorDash, and they're falling in love with Amazon, who comes every other day. So they don't have to, you can live your life literally in your house without having any contact in person. But we all need that, even introverts. So even I noticed that change last year, and throughout the year, introverts, well, I'm doing good. This is pretty much how I always flow, except I don't maybe not do this one thing or two things, but I'm good. And the extroverted people I knew, they were like pulling their hair out. They needed people. But as the year went on, even introverted people recognized that they too also needed, they needed some friends around. They needed to have some conversations with somebody, not only through Zoom. So like most of my clients, they do Zoom work or video stuff because they do their job. And so it's just enough. They needed actual physical proximity, closeness. And emotionally and psychologically, I mean, that's what we need. Our mental health is tied into those connections, you know, and so you have to pay attention to that. And so I encourage, like, that's one of the things I'm constantly encouraging people to pay attention to.
I think this is a great conversation, and we're going to continue this conversation about mental health, addressing something that we've kind of talked about, but it impacts every age group. You know, some people had family pods, but there are quite a few people in the nation who live alone. So I'm going to bring Nancy Petra, who is a advocacy specialist with AARP Georgia, to come into the town hall and talk about this feeling of isolation that happens to seniors, young people, single people, and those of us in the country who live on our own and who've been shut down alone for almost a whole year. So Nancy Petra, welcome to the town hall. And if you could just share something about yourself and how you came to be in advocacy for older adults in our country.
Thanks.
Nancy,
Okay, I think I'm
You're unmuted. We can hear
I'm
you.
unmuted now. Okay, start over. Yes, I was an attorney with the Atlanta Late Society and the Senior Citizens Law Project. So representing seniors and, you know, with nursing home issues and probate and Medicaid, Medicare, a lot of any kind of consumer fraud, scams, those types of issues, home ownership issues. And I started doing advocacy on the side down at the state legislature, sort of around those same issues, and just found that I loved the way the larger impact that you could have when you have a voice in how the legislation is written at the state capitol. So I decided to start moving in that direction and did that for a number of years for older adults. And in late August of this year, in the pandemic, was hired by AARP Georgia to do advocacy, the same work I've been doing for older adults for them. And I've been really happy to be here and be part of this team.
Nancy, can you tell us what isolation has meant to that community, people over 50 in this pandemic?
Sure. Yeah, it's been devastating, especially for those that live alone, for seniors that are homebound. And one of the things that happened is, that we saw when the virus first hit is that the inequality of getting PPE out to home health agencies and those frontline people that were serving homebound people was not really at the top of the list and being prioritized the same way that it was for the nursing facilities and the hospitals. And so it took longer to really get any people that were going into those homes to give them any kind of therapy, maybe check on them once a day, see if they've got a meal. Like they didn't have the PPE to go in. So at the beginning of the pandemic, it hit them even harder because their normal outlets of people that were coming in to help them were not available to them. Because of the inequality in that distribution of PPE and other things they needed and testing and things like that so that they could have the services that they needed. But also, for people that were in long-term care facilities, the isolation, the quarantining that was needed to safeguard their physical well-being took a huge toll. And the isolation, we saw has really added to the virus, taking a lot of these people from us because they were literally dying from the isolation in the facilities as well.
And that's the part, who knew that someone could actually die from lack of human contact? And I know with some families, it seemed like it happened, very fast. But even for me, I'm fully vaccinated and I've, tried to to break out a little bit, but I am still finding when I leave the house, my stomach is going galump. It's like, are you sure this is where you want to go? It's out, and I'm like, you're eating outside, it'll be okay. How will we as a community, as a society, kind of get over that feeling that leaving our house is a danger? It's been baked into us for a year. Dr. Wilson, how do we make our bodies and minds adjust to the fact that, I can go out now with my mask, I'm vaccinated?
Well, part of it is going to require patience. And so we didn't get to this place, in a day or a month, from the beginning of a year ago, really. It took us a while to kind of adjust to the new reality. And at this point, we have, for the most part, we have adjusted to it. We have adjusted our behaviors, our expectations. And those things don't just kind of switch off simply because we wanted to. And we also recognize that not everybody has been living at the same level of concern with regards to the virus. Mm-hmm. And so even the simplest things require a lot more thought than it did 2 years ago. And so just going to the store, you want some ice cream, it's not just an ice cream run. It's like you got to make sure you have a mask. When you get to the grocery store, depending on how many people you see with a mask or not, you decide whether you go in, you go. It's a whole now process. And so at this point, that's the habit that we're living with right now. And so, and for many of us, that is, we're attributing our survival or our lack of maybe contracting the virus to these new behaviors. So you're not going to just readily just give them up simply because there's 3 vaccines out there or people are getting vaccinated. There's still going to be that hesitation and that fear, because unlike other dangers, you can't see the virus. You don't know if anybody is necessarily infected around you, and so there's still that fear. And so even after we get a certain number of people vaccinated and it's herd immunity, I think for many people there's still going to be time that they're going to have to begin to trust, because it ends up being about trust and about fear and safety. And so those things don't just kind of just come back, and so, but dealing with the reality of the virus and the numbers going down and seeing other people comply with being safe will help that process. But you don't want to be the person who says, oh, it's all good now, and then tragically something happened. Like you don't want to be. So you want to err on safety for many people, And so.
And Nancy, what kind of tools has AARP put in place to assist with that isolation that so many people, older people, are living in right now?
Sure. Yes. So this year we have done a lot of great events virtually to reach out to our members and the public and our volunteers to give them outlets. We had a Passport to the Arts event that went on throughout the year, where they could do wellness activities and art activities, and go to the zoo from your home. And we had a Living With series that talked about different types of issues such as diabetes and, health issues that they could learn more about and, educate themselves and be involved. We had, once a week yoga events that we sponsor. We had these great couch concerts that sort of brought music into your home and gave you a reason to get up and dance and, and have fun and, interact with our other members that were online with you. So we did a lot of events like that. We also continued to engage with our volunteers who still wanted to have a purpose and wanted something to do, even though they were staying safe and they were at home, but they wanted to reach out. And so we included them in planning these events and being part of these events. We also, one of my colleagues launched a great sort of postcard writing where the volunteers could write postcards to nursing home residents, just to, give them something to look forward to, something in the mail, something to see, to let them know that there are people that are thinking about them and that they're not alone out there. So we did a lot of events this year. and in the virtual space to engage with the 50 plus and to give them something to look forward to engage in, to be a part of, while they were at home. We also are going to probably continue that because as we, as Dr. Wilson said, like over time and as we slowly come out of this pandemic, people are not going to suddenly just want to go back out and start feeling comfortable with going out to the grocery store all the time and all of that. So I think as we move forward, we'll still continue a hybrid of that to keep some of our virtual events as we get closer to the point that we might be able to do some things in person. But I agree with Dr. Wilson. I think that, early on in the pandemic, for the longest time, all we were inundated with every day were death tolls and case numbers and overruns of ICUs, and that upped our mental health, our mental health issues and the social isolation that we felt. It felt even worse. That fear grew and grew and grew. So I think as we come out of this and numbers go down and cases go down and you start to see people living healthier lives in hospitals, the ICUs are not overrun. As that continues and we can see that in our communities, then people will start to get a comfort level with being able to be out. But we've got a ways to go to get that trust and that comfort level back.
And Dr. Wilson, now this may be a crazy question, but occasionally I've been able to fool myself, like, pretend like your ankle isn't hurt and you can get through this walk and, at least get yourself home. Are there any mental tricks, we can use right now to try to face this uncertain future? How do we let go of that need to control?
First thing is probably not try to have any mental tricks. Like just get tricks. My philosophy around all this and how I work with my clients is like the anxiety goes down, moods improve when you deal with things straight up. It is what it is, because that's the space you have to be in where you find your options. Okay. You know what I mean? And you find your power to maneuver in different ways. Otherwise you start doing a lot of kind of what we call cognitive distortions. Okay. Which is really just your brain lying to yourself to make you feel better or to cope with something. But those cognitions are giving you false information, and can be damaging. Now the damage could be anywhere from, coming up with the wrong conclusion or making a choice that puts your life or a loved one's life at risk or danger. And so my thing is like, deal with it as it is. It's not the boogeyman. It's not the Walking Dead. We're not turning into some zombie movie. You know what I mean? And so, but when you start tricking or doing what I call mental gymnastics, that actually will, in my view, it will lead to increased anxiety reactions, increased depressed mood. It will increase risky behavior. Now, out of all of this, I remind clients, there's nothing you can do that's going to eliminate risk. Your power and your choice is how can you mitigate and manage the risk that's in front of you. But the only way to do that is if you see it for what it is. So, you less likely to be blindsided, be caught off guard, and you'll be less likely to have you'll have more options. And so you won't be stuck. And so I'm a person that I like at least two options, even if I don't like the two options, at least give me two options so I can at least choose one. And so when you do mind tricks or try to fool yourself, or then you get into like magical thinking and mythical stuff and believe in fairy tale kind of like ways around this. Like, don't get caught up in that because that takes a lot of energy. I mean, if you're gonna use all that energy for that, well, why not use that same energy for some constructive, effective, proactive, intentional things you can do that actually will have a positive impact on you kind of managing and maneuvering through this time. Because that's really where the adjustment is going, where you're going to succeed. you know, because we're not going to be in this space forever. At some point, it's going to end, you know. And so, but
so face the truth, face the facts.
Yeah, I mean,
and just keep moving forward.
Yeah, the fact is, I mean, a lot of people have died, unfortunately. A lot of people have been sick, but the reality is, a lot of people have not caught the virus. They have not ended up in the hospital. They have not died. It's been inconvenient. It's been uncomfortable. We've had to do things that we haven't done. We don't want to do, but very few things have been like, you know, so life altering that it causes pain. And it's just, we're used to instant oatmeal. We don't want to have to cook the 8-minute oatmeal. We want the minute one. You know what I'm saying? So don't do the mental gymnastics, because that's just extra work. Why waste your energy, your creativity on that kind of thing?
All right. I want to thank you, Dr. Wilson, and Nancy Peacher. We're going to have you in our next segment, but we've got a word from our sponsor coming up in right now. So, yeah.
Right now, AARP's work is more important than ever. We hear older Americans loud and clear, and that's why we fight for what they and their families need. Access to health care, affordable prescription drugs, opportunities to save for the future, ending age discrimination, a healthy, financially secure, fulfilling life. That's what AARP fights for, because that's what everyone deserves. Join us in fighting for what's right.
Welcome back to our COVID Town Hall presented by AARP Georgia, MedCura Health Centers, and CAU-TV. This is our last segment, and it is about the COVID economy. I want to introduce John Moya from the Urban League, and Nancy Peacher will be back to join us about this segment. We know that the COVID economy has impacted women more than anyone else, but we're trying to, hold on. People got their stimulus checks, but over 77,000 people, I think it was, filed new unemployment claims this week. So, John Moya, if you could introduce yourself to our viewers and tell us a little bit about your background in finance, and then we'll start on this challenge that COVID has brought.
Sure. Yep. Again, I'm John Moy. I'm the policy director for the Urban League of Greater Atlanta, and I've spent the better part of my career really in government and in politics. And I certainly remember during the last Great Recession, I served in New York City as the deputy director of the Governor's Economic Development Council, and that's when I really had a chance to really sort of delve into really certainly the economic crisis that took place then, and this certainly has exacerbated that, certainly taking a look at what happened 10 years ago in terms of the pandemic. So it's a very difficult time. Some of these jobs certainly are not going to come back, but I'll talk to you about that in a couple more seconds.
So one of the things I wanted to talk about was, government has come to the aid of most people. Some people got enough money to pay cash for Lamborghinis, and some people are still barely holding on.
Not me.
So could you just say a little bit about the PPP funding and what's available now in the new act that is supposed to target small businesses a little bit more favorably?
Absolutely. As a matter of, it's a great question. So last night at the Urban League, we had a wonderful discussion with the Small Business Administration. Mm-hmm. We had about 2,800 people actually on that call, if you can believe that or not, and went detail by detail in terms of the American Recovery Plan, that American Rescue Plan that the president just signed a few days ago. So, without going into specific details, it's a great plan. They have certainly extended the deadline beyond March 30th. And it's a great program for businesses really to draw down funds, much needed funds in terms of sustaining their businesses and also keeping employees on the payroll. And so certainly, I would certainly encourage all of our friends who are listening certainly to go to the SBA website to take a look at that. As you recall, the last time there was some concern that really big businesses have really got the lion's share of the dollars. But this time, the way that the recovery plan was certainly written is certainly much more advantageous for particularly for small business owners and their employees. So we think it's a wonderful plan. Really excited about it, and we've really been partnering with the SBA to kind of get the word out for people to sort of apply right now.
And one of the things that this pandemic also laid bare was economics and savings. And a lot of people think they don't make enough money to save. A lot of people just don't think about saving because they're spending their, money up until the next paycheck hits. How can we talk to our community about savings? And how can we teach people that, no matter what you make, if you save $1 a day, end of the year, you got $300 that you didn't have before. How can we get that across to some of the folks in our community?
Sure. My great grandmother who raised me, taught us that, it's not what you earn, it's what you saved. And here is a lady, with a third grade education who was a domestic worker in New York City who scrubbed floors on her hands and knees, literally. And at the end of her life had opened several businesses, purchased a number of homes, and did rather well for herself, but because of just being disciplined. Even if it's $1, even if it's $10, even if it's 10%, you always pay yourself first. So her thing was, John, pay yourself first. So even if it's just 10%, just 10% aside, whatever it is, and just certainly invest it. Put it away, tuck it away, and then as you become more sophisticated, there is CDs and investments and stuff like that. But at least at the very minimum, save something, because I can assure you one thing that COVID has taught us, that a rainy day not only will come, but we certainly don't know how long it's certainly going to last.
And Nancy, can you share with us what some of the lessons that seniors have had to learn this year with the financial change that has occurred?
Sure. Yeah, one of the things that 51% of Americans 50 and over, don't have an emergency savings fund. So to your point, reminding people that just having, a few extra $100 to be able to, is really the difference between whether or not you can pay your groceries, or pay health care. And those are all things that were really exasperated by COVID-19. And what we've seen too is that there was a disparity in the number of workers over 50 who are losing their jobs or being forced into retirement early that really would not have done that otherwise. And so I think only time will tell, as studies sort of show, is this really age discrimination or not. But I think there's statistical data out there and things that's sort of pointing in that direction. And then a lot of those older workers were women. Caregivers that are, they're taking care of someone at home, and whether it be a parent or a child or a sibling in their home, and they're also trying to go to work. And those people, that they don't have access to, paid leave to take care of their family, or, paid sick leave, things like that. They were having to choose between, maybe going to work when they may have a fever and not getting a test, because if they didn't go to work and they lost that paycheck, how are they going to be able to provide for those at home? And a lot of that really revealed itself during COVID for the older workers.
And Mr. Moye, how do we come out of this? So many people are going to come out of this behind. How do we prepare to come out of this so that we do hold on to our homes, or we find that part-time job, or they finally raise the minimum wage? How do you see us coming out of this as a community?
I see us coming out of this, unfortunately, I think, very gradually. Okay. And I think we're going to certainly have to put programs into place. Certainly in terms of home ownership, particularly in the African-American community, we really never recovered from the Great Depression. From the Great Recession, I should say, 10 years ago. But home ownership is certainly still the bedrock of the American dream. We have to go back to basics. We have to learn certainly how to save, how to certainly build our, certainly to build our credit scores, and to certainly to look at organizations such as the Urban League to help folks, certainly in terms of purchasing their home. I think there's also a great opportunity certainly to go back to school. I've been working here in my house for the last year, and it's a great opportunity for people, if you can, to certainly take advantage of work. There's a ton of workforce development, I should say, organizations and city agencies. There are IT grants where you certainly can draw down on some of those funds. So do some investigative work. Now that you have some extra time, how do we prepare ourselves for the new economy? And talking about that, I mean, some of these jobs, quite frankly, are not going to come back. But when you take a look at healthcare, there are certainly sectors that are certainly going to become, are certainly going to boom in the next economy. I think the doctor, the last position was on, certainly was talking about that. So, I mean, there are certainly new sectors that are certainly going to come on board. Do your investigative work, and certainly so that certainly the next time when in this cyclical economy, you certainly all of us are certainly greater protected.
I think even some tech companies are giving access to their certification courses, so that if people are sitting at home and you want to get into tech, they're always hiring.
Right.
You can actually get the certifications to do that. So we mentioned at the start that this has been a her recession, that a lot of women have been laid off.
Yes.
What advice can you give to women out there who are some struggling for the first time? They've always worked their whole lives, and now suddenly, without a job. Either
I would say, Nancy,
no,
Go ahead. Go ahead, John. Go ahead.
Well, Nancy, please, ladies.
No,
first.
go ahead. You start.
Sure. I think, so many, and I'll go again, particularly in the African American community, where women really are the breadwinners in so many households. I would say, first thing I would certainly say, don't get discouraged. Don't do that. Don't be, you certainly don't have to do it alone. There's organizations such as us, such as my organization and others, who will help you sort of get through the difficulty. I had a lady who called today, and she's having a very difficult time. But in this downtime, we can certainly help folks to certainly bridge those gaps in terms of whether it's rental, providing for rent, or certainly financial gaps to get you through. But let's talk about the long term, the long haul, in terms of getting back into school and getting retooled. And quite frankly, sometimes we have to meet people where they are. So you might have to take a job just for now, until we can prepare to kind of get you to where you want to go. So if there's nothing else, I would say for the most part, don't get discouraged. Don't be alone. Find an organization and partnerships to get you on your feet and to get you where you need to go. And we're here to help you. And we want to do that.
And AARP as well has programs for employment. So Nancy, if you want to share a little bit about what AARP does to help employment for those of us 50 and over.
Yeah, so I was going to say, please reach out. We've got resources on our website and things how we can help you. We're here to be that wise friend and help you find education and resources that you need so that you can, definitely get back in the workforce. But I agree with John. We've got to have a long game here, and we're going to continue to advocate. AARP is going to continue to advocate for policies at the state and the local and the federal level that encourage keeping workers 50 plus and women 50 plus in the workforce. I mean, the wisdom and experience that they bring to the job. We can't let those things leave the workforce. So we're going to continue to work for you to encourage policymakers to keep you in your position and not lose that wisdom to the workforce.
Well, I want to start to thank everyone for being with us this evening, and thank our experts, Nancy Petra from AARP Georgia, John Moy from the Urban League, Dr. John Wilson, Dr. Teresa Jacobs, Dr. Jeffrey Hines, and Dr. Elizabeth Ford. And I want to thank you all. Thank you for joining us and listening to these experts. And we want you to be our megaphone. You've gotten some good information this evening. We want you to take that information back to the community, to your church, to your sorority, to your fraternity, so that we can come out of this pandemic in a better way than we entered into it. We want to thank our presenting sponsor, AARP Georgia. We also want to thank our presenters, MedCura Health Center and CAU TV, and WCLK, Jazz 91.9 WCLK. I want to thank Wendy Williams and Deborah Tyler Horton for joining us, and all of those folks over again at CAU TV. We want you to take care. We want you to stay safe, and look forward to you joining us on Saturday mornings at 8 o'clock for the Local Take, where we'll share more information about health and our community. So thank you. Thank you so much for joining us. And we'll be back. This is our first town hall. We'll have a few more this year. So take care. Stay safe.
Jazz 91.9 WCLK, Atlanta's Jazz Station. Classic, cool, contemporary. This is Jazz 91.9, my favorite station. Listen at home, work, on your computer, in your car. Member supported, National Public Radio affiliate. Jazz 91.9 WCLK, Atlanta's Jazz Station. Listen up.
Right now, AARP's work is more important than ever. We hear older Americans loud and clear, and that's why we fight for what they and their families need. Access to health care, affordable prescription drugs, opportunities to save for the future, ending age discrimination, a healthy, financially secure, fulfilling life. That's what AARP fights for, because that's what everyone deserves. Join us in fighting for what's right.